You're watching Good Business San Diego.
Welcome back. The following segment is brought to you by Family Health Centers of San Diego, which serves more than 225,000 people each year. As the largest provider of safety net health care to low-income San Diegans, offering a variety of adult and pediatric services. As we wrap up American Heart Month, we've invited Janelle Kelso from Family Health Centers of San Diego and Dr. Scott Flynn from Blue Shield of California Promise Health Plan in to talk about advances in coronary care, risk factors, and lifestyle adjustments that you can make to help maintain a healthy heart. Thank you both for coming in and talking about this very important topic. So, Doctor, let me start with you. First of all, the most common warning signs that are often overlooked that could suggest you may be having a heart attack.
Well, the most common sign is crushing substernal chest pain, which means I feel like there's an elephant sitting on my chest.
Right.
It can radiate to the arm or the jaw, and that's typical. Particularly with women, up to half of women will have a heart attack and not have that classic sign. They may just have shoulder pain or jaw pain or just feel really off. And if you feel that, you should go in and seek care right away. Do not delay. Okay. Time is tissue.
Yeah, and a lot of people do that. They wait it out. Oh, this is nothing.
As we say, the thing is, you don't call your auntie, you don't call your primary care doctor, right. You don't wait till the next morning, I'll sleep it off.
Yeah.
You get care right away.
Smart. Okay, so Janelle, I know that you focus on underserved and medically vulnerable communities. Do any of the situations regarding heart disease affect that part of the community disproportionately?
Yes, absolutely. Most of the communities we serve disproportionately have higher rates of hypertension, high cholesterol, chronic stress, diabetes, and lack of access to healthy foods. So it's really important for our patients to access preventive services early so we can identify risk as soon as possible. With FHCSD's model of culturally competent care that's embedded within communities of need, we help patients overcome those barriers to access preventive services sooner.
So if you're at a higher risk, that urgency to get in and get treated, get evaluated, much more important.
Absolutely.
For the people you're working with. Okay. So Dr. Flynn, beyond diet and exercise, what are some of the things that we can do to but to help make sure that we are as healthy cardiovascularly as we can be?
Yeah, Janelle alluded to it a little bit earlier. It's really about coming in and getting your health taken care of, seeing your doc, know your numbers, what's your blood pressure? That's probably the #1 preventable cause of cardiovascular disease. And know your numbers, and if you need treated, take the treatment. There's some great medicines out there that are dirt cheap and work very, very well and have low side effect profile. So take care of your blood pressure. Diet and exercise still is important. Right. Exercise, if it was a pill, it would sell for thousands of dollars and be, yeah, right. Exactly. So it's a very key thing to get at least 20 to 30 minutes of some kind of exercise every day. Right. And then the other know your numbers is your cholesterol number. And the big picture of long-term cardiovascular risk factors, your cholesterol is probably your most important one that you can modify as a modifiable risk factor for heart disease.
And all of these screenings are so easily available through Family Health Centers of San Diego too. So Janelle, let's talk about some of the advances to help detect or prevent heart disease and how it is that you're applying this to people within the community.
Yeah, absolutely. Our goal is to bring modern tools to communities and patients that might not otherwise have access to these. So we're looking at things like remote blood pressure monitoring, EKGs, both in-clinic and mobile health screenings for patients to create that access. The wonderful thing about this clinic is that it is a great alternative to the emergency department for appropriate urgent cases, of course. So we're working to see what we can do to reduce unnecessary or avoidable ER visits and get patients seen in a potentially more appropriate setting. The partnership with Blue Shield is wonderful to accomplish that, and we want to make sure we're bringing these innovations to communities everywhere for all of our patients.
And you have so many locations, as I've learned through having you guys on the show through the last couple of years, lots of places in San Diego where you can get these screenings done. Right?
Yeah, absolutely. Over 26 clinics throughout San Diego County, so very accessible. Okay,
so Dr. Flynn, tell us how and why Blue Shield Promise stepped in to help make all of this a reality within this community.
Yes, and in particular, the urgent care in El Cajon was designed to be a cardiology urgent care. It's kind of a unique model that we're testing out there. And it's part of our community partnership. It was a community investment agreement to help improve that access and not have everyone just go to the ER when they're not really sure what's going on, but they can show up there and receive prompt cardiology care in terms of getting blood work done if necessary, EKGs, evaluation, and treadmill tests. They've got a cardiologist on staff there to help them.
Right, the help is there for you. Just reach out to FHCSD.org, right? FHCSD.org. is the website. That's going to do it for Good Business San Diego content segments today, paid for by Family Health Centers of San Diego. Thanks for watching.
This has been Good Business San Diego, sponsored by Wilsey Asset Management.